Good afternoon. Thank you all so much for being here today. My name is Brandy Binkley. I'm the administrator with the Macon County Health Department. And on behalf of the Crisis Communications team, I want to thank you for taking time with us today. And of course, I'd like to thank my partners that are in the room and not in the room today for everything that they have done. As you have probably heard, we expect to move into phase 5 of the Restore Illinois plan as soon as this Friday, June 11th. This is a big deal. I can remember looking at the chart that was sent out from the state and seeing phase 5 as something that almost seemed impossible and like we may never get there. But we are there. And this is definitely a happy, a joyful moment for all of us in our community. So we would like to remind everyone, of course, that the pandemic is not over. So continue to take those precautionary measures, masking, social distancing, staying home if you're sick, washing your hands adequately and frequently, and of course, getting vaccinated if you have not been yet. Please remember that the guidelines can be different in different types of settings, and my partners will go over some of that as we talk today. Different buildings you may enter, different settings like healthcare or congregate settings may have different rules, so just remember that as we move forward with different rules coming forth with masking and social distancing. One of the big reasons for today's press conference is to express our gratitude to all of you, our community here in Macon County. We have asked for so much from you as a community, the sacrifices that you have made, stepping out of your comfort zone and doing things like wearing masks or social distancing or not spending time with your families on very precious days and holidays. And we want to say thank you for everything that you did, not only to prioritize your own health, but to protect and prioritize the safety, health, and well-being of your fellow neighbor and people that you don't know. Thank you so much for all of that. And the Crisis Communications team represents many facets. We've worked collaboratively in Macon County to manage 11,000 cases as a community and much more that our community did not see behind the scenes. We've also administered 72,027 vaccines here in Macon County, and 34.18% of our community is now fully vaccinated. Thank you to everyone in this pandemic for everything that you have done. I know we had to bring a lot of scary, sad, and dark messages sometimes throughout this pandemic, and now is a time of hope and gratitude and thanks for all of you and what you've done. And a special thanks to the healthcare heroes and all of the other heroes in our community, the teachers and school personnel, the essential workers who had to go out when it was very scary to do so, for everyone, for all that you have done. I also just want to take a moment to think about the people who have lost their lives and the people who have lost loved ones during this pandemic. We grieve with you. We are sorry for your loss. And we hope that as a community, we can continue to learn and move forward and live healthier lives in honor of your loved ones. We also are thinking about those of you who are suffering with long-haul COVID. And although you may be released from isolation, you may not be completely recovered. Our thoughts are with you as well. And so I'm thankful for my partners here today that are going to speak and share messages as well. And first, we'll have Julie Moore-Wolf.
Thank you very much, Brandy. When this first hit our community, or we felt it was coming and it started to get really serious, County Board Chairman Kevin Greenfield and I pulled together our crisis communication team. We started with the leadership in our healthcare community, the CEOs of both hospitals, Tanya Andricks from Crossing and Brandy from the health department. And we brought this core group together. We went on to enlarge it as we needed to, because we knew it was important that we were all working as collaboratively, as Brandy said, as possible, but so we all knew what was going on and so that we could be as transparent to the public as possible, because we were going into some very unknown water and a very, very scary time. We brought in law enforcement, we brought in emergency management, we brought in long-term care folks to be part of this team, the school district, and the United Way and some other social agencies, just so we could figure out what to do next. Where were we? What was the situation? How were we going to do what we could do best for our community? You know, the community mask drive started out of this group because, remember, we didn't have enough. We didn't have any. And so we worked on small things like coming together to try and get people to sew masks for our healthcare workers and others to protect one another. Little things like that, major things like trying to get people tested, trying to get people vaccines, trying to get enough vaccine into this community. And we didn't always agree. I'll be very honest with you. We didn't always agree. We weren't always right. But we came through this as a team, and I'm very proud of this community. We set other things aside, competitiveness, silos. We put some things on a back burner because it was more important to work toward the health of this community and getting us through this pandemic. So I want to say thank you to all of these people here, the others who have been a part of this team, as well as our community, because we are very special. Decatur, Illinois, Macon County, we are special people who care very deeply about one another. So thank you, and looks like we made it. Come on Friday.
I'm Tanya Andricks from Crossing Healthcare, and Crossing Healthcare is a federally qualified health center, and our role in this community is to provide comprehensive health care to marginalized or underserved populations. And you'll remember at the beginning of this pandemic, there was a disproportionate impact on communities of color and low-income individuals. And for this reason, our entire team worked together along with the crisis communication team to really try to make sure that we bridged gaps in care and testing and vaccinations to those populations. And I'm very proud of the work that my team did. I'm proud of this community because we came together and really targeted those hard-hit populations to make sure that messaging was appropriate and that we got care and treatment to those populations in a timely way. And we did that, and we worked hard together. We collaborated. I'm grateful for the collaboration that we had with Decatur Memorial Hospital around vaccinations and testing as well. And so I want to say thank you to my team, thank you to the community at large, and thank you to the other members of the communications team, because we did a job very well, and we served this community well, everyone in this community. And now as we move forward, I think it's very important to understand that we still have a lot of work to go as it relates to our vaccination numbers. So if you have not been vaccinated, or your child age 12 and up has not been vaccinated, I encourage you to talk to your healthcare provider and have a conversation about your unique situation and what is best for you as an individual. This is an important decision that you make for yourself, but it's also an important decision that you're going to make for the people that you come in close contact with moving ahead. And so that is the message that I would like to give to folks now moving ahead, to please consider talking to your doctor and get vaccinated. And next is Teresa Rutherford from St. Mary's Hospital.
Thanks, Tanya. So thank you very much. I'm Teresa Rutherford, and I serve as the president and CEO at St. Mary's Decatur. And I will add my gratitude. I'm fortunate. I've just been here since January, so I've come in at the end of this. But what an amazing group of people to join to protect our community. And the work and the collaboration has been stellar. So thank you very much for that. We also would like to thank the community in general for everything that you have done, keeping yourselves and others safe. And hugely importantly, thank you to every healthcare provider and every member of the healthcare team, those who gave direct care and those who took care of our caregivers. We could not have done this without you, and we still have work yet to go. And that's what I'd like to highlight just a little bit. Please remember that when you come into our healthcare facilities, our hospitals as an example, we still have some restrictions in place because of the fact that many of the population we serve are vulnerable to COVID. They are sick, they may have immunosuppression, they may not know what else is going on, and we need to keep them safe. So we will continue to screen as people enter our organizations. We will ask that you wear masks on our premises. We will encourage you to social distance, and we will continue at this point to limit visiting because of the fact that that allows us to keep everyone safe, those coming into our building and those who have come and put their trust in us for their care. So it's great to be part of this amazing healthcare community, and thank you very much, Decatur, and everyone who's helped us get our way through this. So if we continue to be smart, we'll continue to move forward. Thank you.
Thank you so much. My name is Drew Early. I'm the president and CEO of Decatur Memorial Hospital. It's my pleasure to be here today. I'd like to echo a lot of what's been said so far. Thank you to the people standing up here with me today. The level of communication and collaboration that occurred during what were frankly very unknown, stressful, and challenging times is nothing short of amazing. The individuals represented here, as well as many others, work together in a way that is truly had a major impact on the community, and I'm not so sure that the results we saw would have been a lot worse had it not been for this level of collaboration. So thank you to all of you. I would like to thank the community for your support of healthcare workers and first responders. Again, these were very unknown times. There was no playbook for this. And the members of our community, your friends, your neighbors, the people you see in the grocery store and at the t-ball games were out taking care of their community. And that is really laudable work, and the work that went on in this community to take care of our friends and neighbors was something that was truly amazing. So please join me in thanking all of the healthcare workers here in this community. Lastly, I would like to just reiterate what's been said a number of times. Vaccination is absolutely key. Right now, we have vaccine that is safe, effective, and available. There have been millions of doses given, and the data is very clear. This vaccine will save lives, will prevent illness and hospitalization, and continue to put these COVID numbers lower and lower and move this behind us. So with that, I'd like to thank everyone. And again, thank you so much for your support during these challenging times.
And just to finish off today, I want to talk a little bit about what is going to come next. So during phase 5, if you've looked through the guidance to this point that is available, most of what is changing is that there are no longer going to be capacity limits. That's a big deal for our economy, our social lives, and so much more. So that's the biggest change that you will see. There has already been some change with guidance as far as when people should mask or whom should mask. So that is all still in place. Quarantine and isolation is still in place, and there is still precautionary measures like I talked about as far as what is recommended to be followed. If and when there are changes with things specifically like quarantine and isolation, which is a major part of this, we as the health department will definitely put that information out, so you can watch for that, but right now that is not changing. As far as other next steps, get your vaccination. These agencies that are up here and many other businesses are providing the vaccine all days of the week, all hours of the day. So it's definitely available, and there's a very competent healthcare community that is able to serve you to provide that. The other things I hope that we can all take away from this pandemic experience would be to truly realize the impact that health has on economy and all parts of life, and vice versa. We talk about this message in public health all of the time, and I think unfortunately this pandemic has been a true illustration of that. So I think continuing to prioritize not only our own health and well-being, but that of everyone else, not only the people that we know, but the people across the globe. There are still people losing their lives to COVID-19 and many other illnesses. There are still people dealing with long-haul COVID or who are hospitalized, and we don't want to forget about them. We don't want to get into a mindset of if it doesn't affect us, it doesn't matter. I think collectively we all have been through this experience together, and it has really shown us how connected we truly are, no matter where we are in the world. I think another thing we need to continue to prioritize is mental health. There's been so much conversation around it, and we've seen such a negative impact. Let's find the positive to that, and that more people are talking about mental health, and that we need more resources, and that it's incredibly important. And let's not lose sight of that just because things are looking better at this time. We don't have to be negative and dark, but we do have to remember that this is a constant issue that many people face and deal with themselves or their loved ones. I think it's also important to access credible resources as we move forward. There's a lot of information out. You can turn to my partners up here, and you can turn to the health department for information as we move forward. And I also would like to, again, just thank everyone for everything that you've done. I know that it has been an incredible, unprecedented, scary year and almost a half now at this point. And I'm looking forward to all of us moving forward as a community and seeing what other positive impact we can make on the impact and well-being of our community. And I would like to thank my team specifically, again, in addition to all of the healthcare providers here in Macon County and beyond. As I think several of my partners up here spoke to, our community that truly doesn't see what happens all the time behind the scenes, no matter what the job is, but what your healthcare workers have done in this has been selfless, heroic, exhausting. And so thank you to all of them, and thank you to all of you that supported us during this very difficult time.